This video and the portal resource materials have been created for people who need help in order to remain safely at home and out of a nursing home facility. It is a summary of the Advocate's Guide to the Florida Long-Term Care Medicaid Waiver, which can be found on the Florida Health Justice Project website. This is brought to you by the Florida Health Justice Project with support from the Alliance for Aging for Miami-Dade and Monroe Counties and the RRF Foundation for Aging. We are providing this video and the resource materials located on the portal because no Medicaid program is more important, especially now with COVID, and few programs are as complicated. We will not go into every detail of the program. Instead, we'll provide a useful overview so you can know where to find information, some tips for navigating the process, where to get help if you're having questions or problems, and what are your rights. Also, we'll tell you how you can help educate the public and decision makers about the need for more resources. To help you get the most out of this presentation, we divided the video into topics and provided timestamps so that you can easily go to the desired content. Additionally, we have included important resource materials on the portal located directly below the video player. For a limited number of low-income, low-wealth seniors, home and community-based services are provided through the state Medicaid Managed Care Long-Term Care Program. To avoid a long and confusing string of letters, we will call it the Medicaid HCBS program, or just the program. A list of other abbreviations referenced in the video can be found in the resource materials on the portal. The video resource materials will detail the background of the program, who is eligible, and how it is very different from other Medicaid programs. We will provide a roadmap of how to apply and what happens after you apply, and what happens after you are enrolled in the Medicaid HCBS program. We will outline what services are covered and how the plan for your service and care is developed. We will describe what to do if you have a complaint with your Medicaid Managed Care plan, what to do if your services are denied, terminated, or reduced, and finally, we'll review some of the challenges with the program and the importance of sharing your story and how you can do that. The Medicaid HCBS program is different from other Medicaid programs in a very important way. For all other Medicaid programs, like the Medicaid Nursing Home Program, if you meet the eligibility requirements, the state must give you the benefit. For example, the state must pay for you to live at the nursing home. But for the HCBS program, the state is allowed to limit the number of people who can get into the program. So, if you're eligible for Medicaid long-term care based on your medical need for services in the home and your lack of income and resources, you are immediately eligible for nursing home services. However, for the Medicaid Home and Community-Based Services, or HCBS, there is a waiting list. Like all Florida Medicaid programs, people who are eligible pick a managed care organization, also called an MCO, which we address in more detail later in the video. For most applicants needing home and community-based services, HCBS, the first step is contacting the local Aging and Disability Resource Center, also referred to as the ADRC. It is important to know that there are other programs that can provide help for seniors needing HCBS. Some of these other programs, which you may be eligible for and may want to ask about, include Alzheimer's Disease Initiative, Home Care for the Elderly, Community Care for the Elderly, and Medicare. Information about these programs can be found in the resource materials on the portal. During the first call, the intake worker will either give you an appointment for a screening that will be done by telephone or you will get a call back to set up the appointment. During the call, the interviewer will be asking a variety of questions regarding your need for assistance and the caregiver resources that are available to you. The interviewer will ask for information about whether you live alone or have a caregiver. And if you have a caregiver, the interviewer will ask about that person's health and ability to provide care for you. You will also be asked about your health and how it compares to the prior year. You will be asked a series of questions about how your health may limit your activities and the assistance you might need with what are called activities of daily living, ADL. These are activities like dressing, bathing, feeding, maintaining continence. You will also be asked about what are called instrumental activities of daily living, IADL. They include activities like cooking, shopping, housekeeping, using transportation, and handling medication. First, you should have your Social Security number ready and set aside at least 35 to 45 minutes for the screening. You can also ask someone of your choosing to be with you during the phone call while you're screened for HCBS. This can be especially important and helpful if you or your family member or the person you're helping has trouble communicating. For example, the person has dementia or is hard of hearing. Because the screening measures both the need for assistance and the caregiver's resources, it is very important to say exactly what you can do on your own and what your caregiver can realistically do for you. Listen carefully to the questions, answer them fully, and if you do not understand a question, ask for clarification. Based on the screening, you will be given what is called a priority score and assigned what is called a ranking. The rank determines where you will be on the current wait list for this program. More information on ranks and what those mean are in the resource materials on the portal. After you go through the screening, you should receive a written notice. However, the Florida legislature recently changed the law about who should get a written notice of waitlist placement. The new law says that notices will be sent after a screening unless the individual has a low priority score, but the law did not define low score. The state Medicaid agency is now working on a new rule that should clarify what the notice will say and if there will be different notices for people with a low score. As of December 2020, it has not been determined. Information on the current status of the rule and copies of current template notices are located in the resource materials on the portal. For now, the most important thing to remember is to let your intake worker at the ADRC know if your situation gets worse after your first screening. As we said at the beginning, enrollment in the Medicaid HCBS program is limited. There is currently a waiting list. When funding becomes available at the state level to enroll new people in the program, the Florida Department of Elder Affairs sends a list to local ADRC offices telling them who they should contact about possible enrollment. If your name is on that list, the local ADRC will contact you. After confirming that you still need long-term care services and are still interested in the program, you will get a written wait list release notice that includes information about what you need to do to complete the process. The different wait list release notices are located in the resource materials on the portal. Your eligibility for the program is determined after you're released from the wait list. There are two main parts to eligibility. First, you have to meet the clinical eligibility standard. Second, you have to meet the financial eligibility standard. Located in the resource materials on the portal are documents that describe the process and timeline and the materials that you will need to ask your doctor to complete. Basically, it works like this. First, you give your doctor a medical form called the 3008 to fill out and return to the local ADRC. It is important to fill it out completely. The ADRC sends the completed form to the CARES office, which then does an in-person assessment of how much care you need. Currently, there are two major changes to this process due to COVID. Right now, your doctor does not need to complete the form, and the evaluation by CARES is done by phone, not in person. A licensed healthcare provider will meet with you and determine the level of care you need. More information about the different levels of care can be found in the resource materials on the portal. Once your level of care is determined, you'll also need to meet the financial eligibility for the program, which is reviewed by the Department of Children and Families, DCF. It is important that you begin working on your Medicaid eligibility application as soon as you're released from the wait list. Also, it is important to collect all the needed documents like bank statements, pay stubs, ownership of items before beginning the process on DCF's Access website. If you're found eligible for the program, you will be asked to pick which Medicaid managed care plan you would like. If you do not pick a plan, you will be assigned a plan. Here are the plans that are in Florida. You can find the plans that serve your area by checking the resource material documents that have been included on the portal. In deciding which managed care organization to pick, you should contact providers that you like and ask them which MCOs they work with and would recommend for you. You can also contact the Choice Counseling Program. Information about the Choice Counseling Program can be found in the resource materials on the portal. There is also information in the portal about when and how you can change your MCO. The program includes services provided in your home like personal care assistance help with bathing and dressing, homemaker services, home delivered meals, and before COVID forced most senior centers to close, the program covered adult daycare services in the community. Services also include those that are provided in nursing homes, like attendant nursing care. A full list of services can be found in the resource materials included on the portal. What services will I receive and when will I get them? Within 5 business days after you picked your Medicaid MCO, you should be visited by a case manager from your new MCO. Due to COVID, this in-person meeting takes place by phone. During that visit, your plan of care, a written document that identifies the HCBS services you will receive, will be developed. It will include what services you need and the support you receive, both paid and unpaid. More about the plan of care and a sample can be found in the resource materials on the portal. And within 7 days after the initial visit, your services should begin. You should also get a copy of your member handbook at the initial meeting. More information about the handbook can be found in the resource materials included on the portal. It is also important to know that there must be consideration of the limits of your caregivers and how much time they are willing and able to help provide care for you. For example, if your daughter is your main support and she is sick or working, the amount of care she can provide you must be realistic. More information about this supplemental assessment is in the resource materials on the portal. Like all Medicaid services, once you're found eligible for the service, you have certain rights. First, it is important to know that you have the right to be part of your own care planning process. In fact, it should be directed by you as much as possible. You have the right to medically necessary services. It is also important to ask for a copy of your plan of care to review before signing it so you know it is accurate. It is very important to know that if you or your family or your doctor believe you need more services than what is in your written plan of care, you should discuss that with your case manager. And if you still need more services or different services than those in your care plan, you have the right to appeal. It is important to know that your services should be continuous. For example, if your plan of care provides for 5 hours per day of personal care and the home health aide does not show up one day, or the aide comes but leaves early, that's a gap in your services, and there should be a plan in place to make sure that there are no gaps in your care. This is called the gap plan. It is also important to know that the prescriptions you get from your doctor for home health services have to be for at least 6 months. This is called maintenance therapy. For more information on your right to continuous services, see the resource materials on the portal. If you live in your own home or the home of a family member, you can decide who provides many of your services, including personal care and nursing care. This is called the participant-directed option. More information about this topic can be found in the resource materials on the portal. If you have trouble getting a service you need or any other problem with your MCO, you should file a complaint with the Medicaid agency, also called ACA. While some problems may require a formal appeal to fix, the informal complaint process can be the quickest and easiest way to fix your problem. It also helps the Medicaid agency learn whether the same issue is affecting other people so they can fix it system-wide. More information on filing a complaint can be found in the resource materials on the portal. Every plan is required to have what is called a grievance and appeal process. You can file a grievance if you're unhappy with your MCO. For example, if you're treated rudely. You can also file grievances and complaints about the quality of your services. For example, your caregiver often does not show up. An appeal is filed if your managed care organization decides to deny a newly requested service or to reduce or terminate a current service. The MCO must send you a written notice which includes your right to file an appeal. A sample notice called a Notice of Adverse Benefit Determination has been included in the resource materials on the portal, along with additional information about grievances, notices, and appeals. One of the most important things to know is when and how you can keep your current services while your appeal is being decided. Basically, if you're getting a service and it is cut or ended, you must file an appeal within 10 days of the written notice. For example, if you're getting 30 hours a week of personal care assistance and you get a notice stating that it will be reduced to 10 hours per week, you can keep your 30 hours if you file an appeal within 10 days. More information about grievances, notices, and appeals can be found in the resource materials on the portal. As you can see, this is a complicated program, so it's important to know who you can contact when you have questions or need help. In addition to your local ADRC, you can contact your local legal service program or the Senior Legal Helpline. The contact information for your local legal services, the Senior Legal Helpline, and other organizations that might be able to provide you with assistance is included in the resource materials on the portal. There are challenges with this important program. For example, even if you meet the clinical and financial eligibility requirements, funding issues limit the number of people who can participate, and there's a waiting list. And even if you are found eligible and enrolled in the program, you may face hurdles getting the services you need. Sharing your story can help educate the public and officials on the need for more home and community-based resources as an alternative to nursing home care. Sharing your story can also help in your individual case. Please visit the Florida Health Justice Stories website for examples.